Welcome friends to Broken Narratives. I am your host Jay Firangi coming to you from the still city Hamilton, Ontario. Let's get right into today's topic as I continue with my COVID-19 series. How often do you think about your death? Today I will cover how deadly was the COVID-19 and what were the main factors that were associated with bad outcomes if you get infected with SARS-CoV-2 virus, and why this information was very crucial to communicating accurately with population so as not to cause panic and fear. In short, these are the topics I will cover in this episode. 1. The CFR, case fatality rate and infection fatality rate of COVID-19. 2. How COVID compared to flu. 3rd, role of comorbidities or underlying health conditions in COVID outcomes. And finally, why these factors should have been given more attention when making important decisions regarding our response to this crisis. So the first clip will give you an overview of news media's coverage of COVID-19 death rate. It is a compilation by Matt Orfella in which you will hear media talking heads in US accusing President Trump of lying about COVID-19 mortality rate at the beginning of the pandemic and what did we find later in the pandemic regarding COVID death rate. And let's get started with that.
A new warning from the World Health Organization. The death rate from the coronavirus is rising.
3.4% is higher.
Twice as deadly as previous estimates.
3.4%.
The state of emergency.
Well, I think the 3.4% is really a false number. Based on a lot of conversations with a lot of people that do this, I think the number is way under 1%.
So to fact check, the World Health Organization says the coronavirus death rate is 3.4%.
President Trump lies that the World Health Organization is wrong.
The number is 3.4%. 3.4% is what it's being reported around the world.
Making it deadlier. So much death.
The death rate.
The percentage is 3.4%. And no hunch from the president can change that.
Trump lied about the most recent World Health Organization estimate that the global death rate of coronavirus is 3.4%.
The 3.4% death rate was wrong, and WHO data later updated it to
A fraction of 1%.
leading scientists, including Dr. Fauci, wrote in the New England Journal of Medicine that the death rate could be considerably less than 1%.
What is CDC's best estimate of the fatality rate?
It's somewhere between 0.5% and 1%.
A fraction of 1%.
So before I go into details regarding COVID death rate, as I had mentioned that I will cover case fatality rate and infection fatality rate. So what was 3.4%? Was it CFR or IFR? And to give you details on what is the difference, I have a couple of clips from a doctor from Yale University of Medicine, Dr. Perry Wilson. And in this first clip, he will give you details on what's wrong with measuring CFR and how it is measured.
Welcome to Impact Factor, your weekly dose of commentary on a new medical study. I'm Dr. F. Perry Wilson of the Yale School of Medicine. As of this recording, there have been 4.2 million confirmed cases of coronavirus in the US and 147,000 deaths for a case fatality rate of 3.5%. But there are two big problems with the case fatality rate metric, problems this paper appearing in PLOS Medicine attempts to solve. The first problem gets talked about a lot. The case fatality rate is defined as the number of deaths from COVID-19 divided by the number of cases of COVID-19. If you assume we aren't capturing all the cases of COVID-19, and at this point the evidence is overwhelming that we're missing a large proportion of cases, then the case fatality rate becomes really dependent on the denominator, how many people you can test. We tend to test those who are symptomatic, for example, and even among those with symptoms, those with worse symptoms, the type that might land you in the hospital, are more likely to get tested than those with less severe symptoms.
So at the beginning of the pandemic, we did not have enough tests to test large population. So we were only testing people who were ending up in hospital, and that gives you CFR but not IFR because you are not counting all the people who get infected but do not get enough sick so that they had to go to hospital or visit a doctor and do not get tested. And in the second clip, he will give you further information using an example why infection fatality rate is more important than a case fatality rate.
But the second problem with case fatality rate is more insidious, and it has to do with the lag between cases and deaths. Let's conduct a completely unethical experiment in our minds. Take 100 healthy individuals, isolate them on a desert island, and infect them all with SARS-CoV-2 on day 1. What is the case fatality rate on day 2 on that island? Well, it's probably 0. No one has even developed symptoms yet, much less died. But over time, as people get sick and die, the rate climbs until it flattens out at some final number once everyone is either over the disease or dead from it. If you captured everyone with the disease, asymptomatic or not, and waited until the whole thing was over to count how many people died from it, you would have the infection fatality rate. So, case fatality rate dependent on testing, restricted to a moment in time. Infection fatality rate, the thing we really want to know to tell how good we are at treating people with COVID-19.
So what was the infection fatality rate of COVID-19? To find more details, I have a couple of clips of Dr. John Ioannidis. He's a Stanford University epidemiologist, and he had conducted a study in April 2020 in Santa Clara County in California to find out how many people had already developed COVID-19 antibodies, and that is how they find out the infection fatality rate of the COVID-19. So before that, I have a clip of his credentials from a interview he did with McMaster University in 2021.
We have for Research Day 2021 an excellent guest speaker. Dr. Ioannidis is professor of medicine, professor of epidemiology and population health, professor by courtesy of biomedical data science at the School of Medicine, professor by courtesy of statistics at the School of Humanities and Sciences, and co-director of the Meta Research Innovation Center at Stanford, which is called Metrics. He's the recipient of many awards, honorary doctorates. He's a member of many academic honorific societies in the US and Europe, including the US National Academy of Medicine and the European Academy of Sciences and Arts. He has delivered over 600 invited and honorary lectures. The Public Library of Science medicine paper on why most published research findings are false has been the most accessed article in the history of the Public Library of Science, with more than 3 million hits, and I'm sure most of you, if not all, will know this paper. He is among the 10 scientists with the highest current citation rate in the world, with more than 6,000 new citations per month, as per Google Scholar.
So this was just to give you that he is very credentialed and one of the most cited researcher in the world, especially in the terms of how the research data is very flawed when it comes to medical science, and most of it useless. So now the second clip is of Dr. John Ioannidis in April 2020, and what did he find and his team regarding COVID-19 IFR, infection fatality rate.
This study aimed to generate an estimate of how many people in Santa Clara County have been infected with the virus. And the way to find out is to try to see whether they have developed antibodies to SARS-CoV-2. We realized that the number of infected people is somewhere between 50 and 85 times more compared to what we thought, compared to what had been documented. Immediately, that means that the infection fatality rate, the chance of dying, the probability of dying if you are infected, diminishes by 50 to 85-fold, because the denominator in the calculation becomes 50 to 85-fold bigger. If you take these numbers into account, they suggest that the infection fatality rate for this new coronavirus is likely to be in the same ballpark as seasonal influenza.
So in this study, they had tested many individuals in a general population who were not just in the hospital due to COVID-19, but just randomly asking people to take a test, and what they found that spread of COVID-19 was already much higher than we thought, and so that it reduces the infection fatality rate. And towards the end, he said that IFR for COVID-19 must be in the same ballpark as seasonal influenza, which was another controversial take when it comes to COVID death rate. So, but he did not mention what was the IFR in that clip. Now I have a clip from August 2020 in which you will hear WHO, who was saying that CFR, our death rate, was 3.4% in March. And now let's hear what they were reporting in August 2020.
What many groups are looking at right now is what we're calling the infection fatality ratio, which is looking at the number of deaths among all of the people who have been infected. What we understand from many of these studies, these are estimates of the IFR, the infection fatality ratio, is that the estimates hover around less than 1% of 0.6%. We do know that mortality increases with age. We know that mortality increases among people who have underlying conditions like chronic respiratory diseases, chronic heart conditions, obesity, diabetes.
So yes, mortality increases with age and underlying health conditions. But again, this 0.6% IFR was for overall population and not for different age groups. And in this next clip from NBC News and NBC 26 News from October 2020, they will cite numbers from CDC for different age groups. What was the IFR for different age groups?
And here is the current best estimate from the CDC about how many people are surviving coronavirus here in the U.S. Here it is. These are by age group. And these are the estimates of people who are surviving among all people who get coronavirus, including people who do not show symptoms.
So these are survival rate for COVID-19, and he did not read out the numbers. So let me just give you the numbers. For 0 to 19 years, survival rate for COVID-19 was 99.997. 20 to 49 years, it was 99.98%. 50 to 69 years, it was 99.5%. 70 plus years, 94.6%. These are the survival rate numbers.
Here are those numbers shown in a different way. Here's the current best estimate of how many people are dying from a COVID-19 infection. So for example, people aged 0 to 19, for every 33,333 who get an infection, one person is dying, according to this estimate right now.
And for 20 to 49 years, 1 in 5,000 was dying from COVID-19. 50 to 69 years, 1 in 200. And 70 plus years, 1 in 18. So you can see that a COVID-19 death rate, infection fatality rate changes very much based on your age. And give you more details like how many people in different age groups were dying from COVID-19. I have some articles that I want to go through. First is from Statistics Canada, reduction in life expectancy directly associated with COVID-19 in 2020. This was published in June 2021. The average age of Canadian who died of COVID-19 in 2020 is 83.8 years. By comparison, the average age at death in Canada in 2019 was 76.5 years. So people who were dying from COVID-19 in 2020 were older than people who were dying like average age of death in 2019. And here they have a table, and two things to notice here are like average age at death due to COVID-19 and life expectancy in 2019. And as you can see the numbers, except from Manitoba and Saskatchewan, people who were dying from COVID-19 were dying at a higher age compared to life expectancy in 2019. Let's look at more articles. This is from Global News. COVID-19 deaths lowered Canadian average life expectancy to 2013 levels. StatCan. And let me give you just one detail that I want to mention. As of May 28, 65.7% of COVID-19 related deaths in Canada were reported in those 80 years and older. So 65% were 80 years and older in 2020. And let's see what happened in 2022. This is from CTV News. Life expectancy for Canadian fell in 2022 for third year in a row, says StatCan. And more than 19,700 Canadians died of COVID-19 last year, Statistics Canada said. Seniors bore the brunt of the increase, with those aged 80 and older seeing a 78% jump in COVID deaths last year compared to the year before. People aged 65 and older accounted for 91.4% of all COVID deaths in 2022, report said. So in 2022, more than 91% who were dying from COVID-19 were over the age of 65. And for people over the age of 80, the percentage even increased in 2022 compared to previous years. So this gives you a pause that how come then people who are pushing for lockdowns and all the kind of mandates, mask mandate and social distancing and vaccines, how could they say that these things worked if the people, a number of people who were dying in over the age of 80 from COVID-19 increased in 2022. And this is how it looks like on a bar graph for Canada. Number of COVID-19 deaths in Canada as of May 2nd, 2023 by age. As you can see on the left, they start from 0 to 11 years of age, and towards the right it goes to 80 plus, and most of the deaths were in 80 plus years and 70 to 79 plus years, and there is very little numbers on the younger age groups. Let's see for US. This is from ABC News. More than 90% of COVID deaths occurred among elderly adults, CDC. This was published in November 2022. As of the week ending November 19th, Americans aged 65 and older make up 92% of all deaths from the virus, according to data from the Centers for Disease Control and Prevention. And this is how it looks for US. This is from CDC website, deaths by age group. And 0 to 4 years comprised only 0.08% of all COVID deaths. 5 to 11, 0.03. 12 to 17, 0.05. 18 to 28, 0.6. So these were the numbers that should have been mentioned and given more focus by mainstream news media, but they did not. And like anyone can get it, anyone can spread it, and the message that was given that anyone can die from this disease, which is true, but it's not everyone is had equal chances of dying from this disease. And this last article regarding how older people were dying, mostly older people were dying all over the world. This is from JAMA Network. Most COVID-19 deaths worldwide were among older people. More than 80% of global COVID-19 related deaths between 2020 and 2021 occurred among people aged 60 years or older, according to data published by the World Health Organization in Morbidity and Mortality Weekly Reports. This is not to say that we shouldn't have done anything, but the response should have been age appropriate. As you can see that if more people in older age are dying and there is very less number of deaths in a younger age group, response should have been according to those numbers. And one more article from Brownstone Institute, a closer look at COVID mortality rate. This article has so much details in it, you can read through it. I will provide the link for the article, but I just want to mention one line here. For those age 0 to 69, which covers 94% of global population, the fatality rate was 0.095%, meaning the survival rate for nearly 7.3 billion people was 99.905. Did you know about this number? What do you think about this number, that most of the people under 70 had a survival rate of more than 99%? And does this change anything regarding how you see how we responded to COVID-19? So this was regarding how age was the biggest factor when it comes to bad outcomes of COVID-19. Now in this second segment, I will go through what were the reporting on how COVID compared to flu. And this next clip is from October 2020, where Dr. Anthony Fauci was responding to President Donald Trump at that time, comparing COVID-19 to flu. And what was Dr. Anthony Fauci saying regarding that?
This is not a trivial disease. People in the United States should realize that it is not a trivial disease. The potential for what COVID can do, what SARS coronavirus 2 can do, is very, very much different from influenza. You don't get a pandemic that kills 1 million people, and it isn't even over yet with influenza.
So yeah, again, WHO was also saying that it was much more deadly than flu, and people did not have immunity to COVID-19 because it was a new virus and it was spreading much rapidly than flu virus, and we did not have treatments. Those kind of things were mentioned when it comes to comparing COVID with flu, but not everyone was on the same page when it comes to this topic. As you heard, Dr. John Ioannidis compared COVID to flu, that overall infection fatality rate was in the same ballpark as seasonal flu. Here is another clip of a doctor from Johns Hopkins University, Dr. Marty Makary, in June 2021, again giving information that should have been given more attention, that not everyone was at equal risk by COVID-19, and people had a very distorted idea of how deadly COVID-19 was for different age groups.
Joining us right now is Dr. Marty Makary of Johns Hopkins University. He predicted that the United States would reach herd immunity by April.
Well, good morning, Becky. It's good to see you. You know, I think there's a lot of good news out there, and I think that people need to hear that good news right now. People have an entirely distorted perception of risk. Remember, COVID now has a different case fatality rate because it's circulating in a much younger population, in a population where the case fatality rate for COVID is now similar to that of seasonal flu. In the past, comparisons were not fair, but now we're seeing a similar case fatality rate, and 1/50th the number of cases of flu on a daily basis compared to a mild flu season. In healthy kids is so exceptionally rare, it would be considered a case report. And as a matter of fact, there's never been a documented case of a young, healthy person dying of COVID. And we've done some of that research at Johns Hopkins. All the children that have been examined in half the nation's health insurance data have had a comorbidity.
And one more example of Bill Gates comparing COVID-19 to severe flu season after cashing out on his investment in vaccine manufacturing companies. And this is from May 2022 when he did an interview with Fareed Zakaria.
And then at that point, we didn't really understand the fatality rate. You know, we didn't understand that it's a fairly low fatality rate and that it's a disease mainly of the elderly, kind of like flu is, although a bit different than that.
But if you compared COVID to flu at the beginning of the pandemic, like you were called, like you are a conspiracy theorist and you are a nut job, those kind of things. But here you heard few doctors and Bill Gates who was pushing for all the measures, lockdowns and vaccines, mandates and all kind of those things, also comparing COVID-19 with severe flu season. And here is one article that will give you how COVID-19 compared to flu from University of Cambridge, and this data is before like 3rd July 2020, data before that. And let me read you some details. For each age group under 20, fewer have died with COVID than COVID than on average die from flu each year. Right? For each age group under 35, fewer have died with COVID than on average die from road accidents each year. For each group under 50, fewer have died with COVID than on average die from accidents and injuries each year. So this gives you more perspective and a better picture of how COVID compares to different diseases. Like, so do you worry about flu every seasons, like people who are under 20 or people who are under 35? Do you think about like your death every time you go out and drive a car, because people under 35, even under 20, there are more people who die in car accidents and other kind of accidents. They ingest drugs that they are not supposed to, and drug overdose and those kind of things are also at more chance that if you are under 35 you will die that way than compared to COVID. But this kind of information was not provided by mainstream news media. And the last line that I want to read here: note that over 80% of COVID deaths are to those with a pre-existing medical condition. If we conservatively assume that at most 40% of population have such a condition, then the COVID death rate for people without such condition are less than a third those reported above. So if you have no underlying condition, your chances of dying from COVID-19 even goes down. And this is the third topic that I had mentioned, that comorbidities, underlying health condition, how those affected your outcome when it comes to COVID-19. And let's get some more details. And the next clip I have is from May 2021, and this is from BBC News in UK. And you will hear Jonathan Philip Chadwick Sumption. He is a British author, medieval historian, former senior judge who sat on the Supreme Court of United Kingdom between 2012 and 2018. And in this clip, when asked about by BBC reporter that COVID was very deadly and it has caused havoc in UK and all around the world, let's find out what was Lord Sumption's response to that.
We are at a point where by the end of April there were 50,000 excess deaths in this country, of which about 36,000 were directly related to COVID-19. It's a bit difficult to know what the cause of the other excess deaths were. But the evidence is clear, isn't it, that this virus has taken a terrible toll on the population?
No, the evidence is not clear to that effect. More than 9/10 of the deaths are cases in which the death certificate shows that there were multiple causes of death, and coronavirus was only one of them. This is a virus that attacks people with really serious pre-existing vulnerabilities, and that's consistent with all the statistical analyses.
Yes, but they wouldn't necessarily have killed them at this point in time, would they? They might have lived with them for many years.
No, not for many years. Almost all of these people are very old and suffering from quite serious conditions serious enough to be mentioned as a cause of death on the certificate. The overwhelming majority of them would have died a bit later, but not much later anyway.
And here are some more details on comorbidities. And this article is from worldhealth.net. 96% of COVID-19 fatalities in Italy suffer from other illnesses. This was published in May 2020. The average age of patients who have lost their battle with the disease is 80 years old, and close to 96% of the COVID-19 fatalities in Italy had previous medical conditions based on data from the country's ISS Health Institute. One article from CTV News: dementia, Alzheimer's, most common comorbidities associated with COVID-19 deaths. StatCan, published in May 2021. StatCan reported that of the nearly 15,300 people who died of the virus between March and December 2020, 89% had one or more medical conditions or complications listed on the death certificate. 65% had 2 or more comorbidities, and 46% had 3 or more comorbidities listed according to the report. And here is another one from CNBC. CDC study finds about 78% of people hospitalized for COVID were overweight or obese from March 2021. About 78% of people who have been hospitalized, needed a ventilator, or died from COVID-19 have been overweight or obese. the Center for Disease Control and Prevention said in the new study on Monday. And one more here from CDC's own website, cdc.gov. And this is for deaths by select demographic and geographic characteristic. And I just want to mention one details when it comes to comorbidities and other conditions. The number of deaths that mention one or more of the conditions indicated is shown for all deaths involving COVID-19 by age group. For over 5% of these deaths, COVID-19 was the only cause mentioned on the death certificate. For deaths with conditions or causes in addition to COVID-19, on average, there were 4 additional conditions or causes per death. So, as you see that people who were dying were mostly elderly, and they already had so many 3 to 4 different comorbidities. And so all the lockdowns, during the lockdowns, did you guys eat more healthy? Did you gain weight or lose weight? If you drink, did you drink more or less? Did you exercise during the pandemic? They had closed down the gyms, but liquor store were open. You can drink. And people who had issues with drinking, alcohol anonymous, like get together 1-to-1, that was banned, but you can still buy alcohol, and those stores were considered essential. So how would that help to improve your health, like drinking more, eating unhealthy food during the pandemic, just staying in the closed door, not getting enough sunlight? How did that affect your health overall? And this was regarding comorbidities. Now let's see how, like especially in North America, how news media was mostly reporting negative things even when there were good news on the way. And this clip is the next clip I have is from a Real Time with Bill Maher show, which is on HBO since 2003. And he's gonna talk about one study that Washington Post, I think they had done and conducted a survey that mainstream news media in North America were mainly reporting negative news even when there were positive news as well.
Over the past year, the COVID pandemic has prompted the medical establishment, the media, and the government to take a scared straight approach to getting the public to comply with their recommendations. Researchers at Dartmouth built a database recently monitoring the COVID coverage of the major news outlets across the world and found that while other countries mix the good news in with the bad, the U.S. national media reported almost 90% bad news. Even as things were getting better, the reporting remained negative. In a recent Gallup survey, Democrats did much worse than Republicans in getting the right answer to the fundamental question, what are the chances that someone who gets COVID will need to be hospitalized? The answer is between 1% and 5%. 41% of Democrats thought it was over 50%. Another 28% put the chances at 20 to 49. So almost 70% of Democrats are wildly off on this key question and also have a greatly exaggerated view of the danger of COVID-2 and the mortality rate among children.
So if you had to guess about the hospitalization number, what would have been your guess? As he said that it was like 1 to 5%, and that also depends on your age and underlying health conditions, as I just went through all the information. So why does all these things matter? And it matters because the response to COVID-19 disproportionately negatively affected children, and not most of the deaths and havoc that caused by COVID-19 was in older age group, but the response that negatively affected young children. And here in this next clip again of Bill Gates from that same interview regarding school closures during the pandemic.
There was a lot of uncertainty about, for example, school shutdowns. To this day, there's still arguments about how many cases that avoided. It's pretty clear because young people don't get sick from the disease very often. that we probably, if we knew everything we know today, we would have shut schools down a lot less than we did during this pandemic. K through 12, we have a learning deficit that will take us a long time to erase that. And sadly, it's a deficit where the inner city is where it's almost 2 years, suburban schools less, private schools in some cases, like my kids, almost no deficit at all.
So yes, people who have money and means to educate their children throughout the pandemic with the private tuitions and whatever, they did not have learning deficit. But people who go to public school and do not have this kind of money and means to educate their children, they had issues. And as he said, the issues were much larger in inner cities and I think developing countries as well, compared to wealthy nations in developed countries. One more kind of reporting by Dr. Phil McGraw. He is a very famous host of Dr. Phil show. He ended his show I think in 2023 when he was on The View in 2024. This is what he had to say regarding school closure when it comes to our response to COVID-19 and how it affected children.
Think about it. In like 08, 09, smartphones came on, and kids stopped living their lives and started watching people live their lives. And so we saw the biggest spike and the highest levels of depression, anxiety, loneliness, and suicidality since records have ever been kept. And it's just continued on and on and on. And then COVID hits 10 years later, and the same agencies that knew that are the agencies that shut down the schools for 2 years. Who does that? Who takes away the support system for these children? Who takes them away and shuts it down? And by the way, when they shut it down, they stopped the mandated reporters from being able to see children that were being abused and sexually molested, and in fact sent them home and abandoned them to their abusers with no way to watch, and referrals dropped 50 to 60%. So
there was also a pandemic going on, and they were trying to save
kids' lives. Remember, we know a lot of folks who died during this. So it wasn't, people weren't laying around eating bond, but, well, you know what? We're lucky. Maybe we're lucky they didn't, because we kept them out of the places that they could be sick, because no one wanted to believe we had an issue.
Are you saying no school children died of COVID?
I'm saying it was the safest group. They were the less vulnerable group, and they suffered and will suffer more from the mismanagement of COVID than they will from the exposure to COVID. And that's not an opinion, that's a fact.
And if you are worried about that your young children will transmit the virus to their grandparents, that could be just managed by not allowing young children, if they are sick, to not get in touch with their grandparents that often. How difficult is that, rather than just closing the schools and causing all these kind of problems. So in the last segment, I just want to go through 3 articles. Some countries had a different response. Here is from Free West Media. Norway reclassifies COVID-19 no more dangerous than ordinary flu. COVID-19 is treated in the mass media as a very dangerous disease, in the face of which mass vaccination and severe restrictions for the whole society are applauded despite few deaths beyond the risk groups. But in Norway, it has now been decided to treat it like other respiratory diseases such as influenza or the cold virus, because according to the Norwegian Institute of Public Health, it is no longer more dangerous than this. This was published in September 2021. Here is an article from time.com. World Health Organization declares COVID-19 a pandemic. Here is what that means. This is the article that goes into detail about why and how COVID-19 was declared pandemic by WHO, but I just want to mention few details which are eyebrow raising. The WHO defines a pandemic as a global spread of new disease, though the specific threshold for meeting the criteria is fuzzy. So to declare a pandemic, the criteria is not even clear. The declaration refers to the spread of the disease rather than the severity of the illness it causes. So it is not considered, severity of disease is not taken into consideration when declaring a pandemic. In some ways, declaring a pandemic is more art than science. Dr. Anthony Fauci said in February, "It really is borderline semantics, to be honest with you." One more paragraph. Pandemic is not a word to use lightly or carelessly. It is a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and deaths, said Dr. Tedros on March 11th. Describing the situation as a pandemic does not change WHO's assessment of the threat posed by this coronavirus. It doesn't change what WHO is doing, and it doesn't change what countries should do. But it did change what countries did, because they used that WHO has declared a pandemic, and now based on that they had started imposing that death rate is 3.4%, and we need to mandate people to do this and do that, and divide individuals, people into essential and non-essential workers, and all those kinds of things were done based on WHO's declaration of pandemic, and like COVID-19 had a death rate of 3.4%. And this final article summarizes accurately what I feel regarding COVID-19. This is from the Washington Times. Coronavirus hype. All right, what happened right there? Oh, I think I lost connection. That's it for that. So yes, COVID-19 was hyped, and the virus was real. It was killing some people, mostly older people who had so many underlying health conditions, and did nothing to vast majority of population. And yeah, that's the summary. Like, IFR was very much dependent on your age and underlying health conditions. Most people under 60 had more than 99% survival rate, and children were least affected by COVID-19, and but the response, they were most affected by the response to COVID-19. That's it for today's episode. I hope you check out the show notes, and if you want to verify any of the information I have shared, if you find the information that I have provided in this episode useful and accurate, please share with others, with your family, friends, colleagues. And you can find my show on YouTube and Rumble. And with that, I would like to thank you for your time. I'm your host, Jay Firangi. You have been listening Broken Narratives, and I will see you in the next episode.